I'm Nancy Lindell, Public Relations Manager for Mission Health. I'm here today with Dr. William Hathaway, our Chief Medical Officer here at Mission Health and for the North Carolina Division of HCA, to provide the community with an update on COVID-19. Dr. Hathaway, thanks for joining us today.
Thanks, Nancy. It's nice to be back on what's turning out to be weekly updates.
Yes, I think it's really helpful for us to be able to inform the community and let them know what we're experiencing, what we're learning, and what's going on at the hospital. So let's start with that. Let's find out what's going on with the hospital. There has been this week a lot in the news. I think daily we exceed our hospitalized patients rate in the state of North Carolina. How is that here at home in Mission Hospital?
Yeah, it's been really interesting for us to follow. It's one of the key metrics that we look on a daily basis, that being, number of patients in North Carolina who are hospitalized with COVID-19. And we have seen an increase over time. It's been a daily increase in the last 10 days. In the early part of mid-June, we were in the 800 range, and more recently, we've climbed above 900 and are pushing 1,000 hospitalizations as we speak. We track that number locally. We track it both within Mission Health System, and then I track it in conversations with my colleagues at the other health systems in the region. As I've said before, and I'll say it again, we had risen to an average number between 15 and 20. That number more recently has crept up to a little bit above 20. I think I was concerned early that it may have been just an isolated spike, but I'm becoming increasingly confident, I guess is the word, or confident in the number anyway, that we're seeing closer to 25, maybe a little bit above that as an average rate. And whether that'll be sustained or not remains to be seen.
And when we're talking about these numbers, there's different ways to look at these things, but we're talking about people who are sick enough to be in the hospital.
Yes, a couple of important points there. One, the cases are rising. We've seen that in the news. They're rising nationally. They're not rising at uniform rates in different states, and that's in large part due to different levels of restriction on mobility. The states where they've increased mobility by opening the economy the fastest have seen the highest number of cases rise. Examples being Texas, the state of Florida, and Arizona have seen really substantial increases in the number of cases on a daily basis. And that's translated into increasing numbers of hospitalizations and demand on services. As you remember early on in early March and April, when we were first entering our phase of the pandemic, our concern was that we wouldn't have capacity to care for these patients. We talked about flattening the curve. The term flattening the curve doesn't seem to be used as often as it was initially, but I think it's ever as important as it ever was that we continue to try to flatten the curve by practicing good physical distancing, wearing masks, waiting 6 feet apart, washing our hands. We've said that repeatedly. Those cases have risen in other states. They've risen here also, but not as quickly. And I think that's in large part attributable to the fact that we haven't opened bars and restaurants and other social venues and still have limitations on the number of people who are allowed to gather at a given time.
And currently, while we are seeing a rise in the number of people that we are treating for COVID in our hospital, we're not at our capacity, but the number is still concerning.
Yeah, so as was the case early on, the unknown of what might or could happen has always been concerning. And as we trailed New York, we trailed Italy and Iran and China initially, then it came to our country and affected other cities first. We had great fears that we would see that tsunami of patients as they did in other areas. Because we flattened the curve early, we didn't see that. Now it's not a tsunami, but it's a steadily rising tide of patients that we're seeing. And we put in multiple protocols and plans in place to be able to handle the increased capacity. And we're still at a place where we have adequate capacity to do that, but we don't know what's around the corner. We don't know if there'll be a sudden rise in the number of cases. As an example, one of our counties in western North Carolina, Macon County, has seen a tremendous rise in the number of cases over the month of June, from in the 10 to 20 range to up to almost 300, if not over 300 cases at this point in time in a 1 month period. That could happen here too. That can happen anywhere if we aren't really careful and really attentive and adherent to the social and physical distancing that has allowed us to handle the pandemic so far. And I think it's also important to emphasize that if we practice those 3 W's, not only will we protect the health of our community, our friends and families and neighbors, but we'll also be able to continue to open the economy in a fashion that we need to, so we can protect the economic health of the community too. If we do not follow those 3 W's, and if we assume that we were back to the normal that we were before this pandemic, we'll find ourselves in real trouble, and I don't want to see that. But I think if we all work together, if we bond together as a community, we recognize that wearing a mask is critically important, not just for our own health, but more important for the health of everybody, including the economic health of the community, we can handle this.
This can't be a circumstance where only 2 people in the group are doing all the work.
No.
Everybody has to do it.
That's exactly right. If you think about group projects, it takes an entire village to make this happen. And so we're calling and asking everybody to be attentive in all circumstances. One of the things that we've seen we've become very familiar with people. And in the work situation or in other social situations, and we make assumptions that they are okay. We've learned that with the ability to spread the virus asymptomatically, that's not always the case, and that we shouldn't be making those assumptions that being with friends without a mask is okay because they must be okay. You just don't know. And I think the right thing to do right now is assume that not simply that everyone else is infected, that you may be infected too, and so wearing that mask prevents you from transmitting it to other people.
Exactly. And I think what we sometimes fail to mention is that we understand that this takes an emotional toll on everybody. I mean, following the W's, not being able to hug each other, shake hands, be the social creatures that we are, and wearing masks in public. I mean, I've stopped and told people, I'm smiling at you, I'm smiling back, so that they know. I mean, it is a new and different way, and it does take a toll on everybody, but I think we can also talk about here the emotional toll that it takes on families who are not allowed to visit someone on the COVID unit, and the emotional toll on those that work in our hospital on that unit.
Yeah, that point we've made before and make it again. We have gone to visitor restrictions. We've loosened them a little bit to allow at least 1 visitor per family member at certain hours of the day, and that same visitor on a given day, not multiple different visitors. And we think that's critically important for everybody to heal. It's important to have that social and emotional support when we're sick and in the hospital. But we have to be careful not to lose the 3 W's while we're doing that.
Right, and we've also made known that the COVID unit is the exception to that rule. We are not having visitors on that unit, and that's difficult on everybody. It's difficult on staff, it's difficult on families. While we're on the topic of our COVID unit, we are doing our convalescent plasma treatment for some of our patients there, some of the more critically ill patients. Can you talk about how people can help with that?
Yeah, I'm happy to. To refresh people's memories, the principle involved here is that when people get sick with COVID-19 or any illness, bacterial or viral illness, part of the body's natural defense mechanism is to develop antibodies. That virus in this circumstance comes into your body recognizes elements of it as foreign, and it says, I have to fight that off. Well, we fight that off by white blood cells in the body producing proteins called antibodies. Those antibodies bind to the virus and neutralize it and prevent or diminish its ability to spread within the body. That's the principle of a vaccine. We inject an antigen into the body and then we develop those antibodies and we become immune. Well, we don't have a vaccine at this point in time, and so what we are doing, and this is an old therapy that dates to well over 100 years old, we take the serum or the plasma from people who have been infected by the SARS-CoV-2 virus that causes COVID-19, and we take that serum from those people who have recovered and give it to people who are ill with it, and that way we transfer those antibodies, those vital proteins to fight the illness, to give them at least a short time period of acquired immunity to the illness. And so as part of our program at Mission and our therapy, we are treating patients with convalescent plasma serum, and we're using what we need are more volunteers to give us that serum once they've recovered. And so if you have been infected and you know you have recovered, we would love if you would reach out to the Red Cross or the Blood Connection to offer your services, donation, not of blood, but of plasma in this circumstance, so that we can use that as a therapy for patients who are critically ill in the hospital.
And it's my understanding that we're fairly critically low, if not out of convalescent plasma.
It comes and goes. The supply comes and goes. You know, one of the benefits of being isolated in Western North Carolina is that, relatively speaking, we've had fewer cases than the rest of the state or the rest of the country, but we still have people who are getting ill, and so we have fewer people who are able to donate. And so it's critically important that if you have been infected and you want to help, that you can do so by donating your blood products.
And what other treatments are there available right now with COVID?
Well, every day we're learning more. Unfortunately, as is often the case, you know, we have lots of antibiotic therapy for bacterial infections. Bacteria are a little bit different than the infections are a little bit different than viral infections, although they can have a lot of the same clinical manifestations. But we have good antibiotic therapies for bacterial infections, while we don't have such good antibiotic therapies for viral infections across the board. There's one, remdesivir, which was initially used in the Ebola crisis as an antiviral medication, and that has had some benefit. It's not widely available at this point in time. We have supplies at Mission, but they're not as widely available as we would like. And it's not while it may actually save a life or two, it is not a panacea in the sense that it'll cure everyone who comes in with the illness. It's important, and so we use that. The other one that newly came out is an anti-inflammatory medication, a steroid called dexamethasone. There was a large clinical trial done in the United Kingdom. There's a group of clinical trialists there who are investigating a host of therapies, including remdesivir, and they randomized over 6,000 patients to receive either usual care or dexamethasone. And they found that they were able to decrease the mortality in the group who got dexamethasone if the patients were requiring oxygen or were on a ventilator. So we are using that steroid, that anti-inflammatory medication, for critically ill patients who require oxygen or are on a ventilator, and that has been shown to decrease mortality. So people live longer and have a better chance of survival if they get that therapy. Now, it's not good for everybody who gets the COVID-19 infection. There's a subset of patients who would recover normally anyway, and we have a little concern that if we give this anti-inflammatory too early in the course of therapy, that the patients may actually do worse. So it's really reserved for those who are critically ill and not just the routine run-of-the-mill COVID-19, and we don't want anybody using steroid therapies on their own, because that actually may be harmful.
That's good to know. And as far as our critically ill patients or persons who we've had in the hospital have passed away from COVID, I hear a lot of people talking about the elderly and people with comorbidities, meaning other health issues that are causing them to die from this, and that's not necessarily the truth. There are others. Everybody is susceptible to passing away from this.
Yeah, that's exactly true. We do know that the older you are and that the more comorbidities that you have, the higher your likelihood of having really serious consequences, including death from the virus. 80% of all the deaths occur in people above the age of 65. That's a national number, and it's been proven to be the case here too. But that doesn't mean you're immune if you're less than 65. We have actually had some very, very tragic cases of people in our own community, a 30-year-old and a 39-year-old who have passed away despite using our most intense therapies, a therapy called ECMO, which is really the highest technological therapy to oxygenate people's blood. And even those therapies were not effective in helping them. And then I heard of a tragic case of a 21-year-old Penn State student who had died recently. So we know that it can happen. Even though the likelihood is lower, it can happen. Now, along those lines, the age group of the people who have been infected recently appears to be younger. We're seeing a shift in the median age of the people who are being infected. And I don't think that's a surprise when you think about why people are being infected. Increased mobility in the community. The 20 to 50-year-old age group is highly mobile. They're going out and being more social. And so they are getting more of the infections as opposed to the older folks. But that's just a cautionary tale that we need to be mindful of. You know, let's do things that we absolutely have to do, and when we do those things that we have to do, let's be cautious at how we do it so that we're still wearing masks, waiting apart from each other, washing our hands frequently, not putting ourselves unnecessarily at risk for getting the infection and then spreading the infection.
Exactly. And I think sometimes people think, well, this is not that bad. You know, I'm 40 years old and I'm not going to get that sick, I'm not going to die. But it can be, even if you're not deathly or on a ventilator, it can be a pretty nasty illness. I mean, you don't want to get this.
Absolutely true. I mean, death is not the only outcome. I mean, there's sickness and recovery and chronic consequences that can happen from it. And then, of course, as we've said repeatedly, when you become infected, you can infect other people. If you prevent yourself, if you assume that you're already infected and behave accordingly, we can stop the spread of the virus. And we just don't want it to work its way through the community sequentially until it finds someone that's vulnerable.
So I want to go out this weekend. Tell me how I can safely be out and about in Nashville this weekend.
We want people to continue to get exercise, that's for sure. We want people to pay attention to their health, both their physical and their mental health, and we know that exercise is important. And so we encourage walking and hiking and activities where you can maintain some social distancing. Where you can, wear a mask. If you're going to be all alone, you obviously don't need to wear a mask, and that's okay. If you're going to gather with people, I would just ask that you really think about how important it is to do so, and then if you choose to do so, limit the size of the groups of people that you're with, limit how close you are together, and continue to wear a mask while you're in the presence of each other. That's respectful and smart.
And washing your hands. I mean, even though you have a mask on, you're eventually going to take it off. Don't put your hands on your face, and wash your hands.
Yeah, wash your hands, and then that's critical with some kind of a disinfectant, an alcohol-based disinfectant. And think about what you're touching. Where are you putting your hands? How are you opening doors? How are you, when you shop, wipe down the things that you purchase after you bring them into your home, and be really cautious about those kinds of activities.
As we end our talk today, can you tell us what can we expect going forward, and what do we need to do as a community?
Well, I think we've learned that this is a marathon and not a sprint. That while it feels like we're running really fast all the time, that we better start being prepared for living with COVID-19 and this new normal, whatever that turns out to be, for quite some time. And I think all of us need to look at other communities, historically what happened in New York, or currently what's happening in Texas and Florida and Arizona, and look at that as a very cautionary tale for what could happen here. I've said it before, we have not created immunity in the community, and until that happens, we have to be very, very cautious. We're already feeling some of the effects of Florida and Texas based on availability of personal protective equipment. While we still have ample supply right now, there's a chance that if those cases rise in other areas, that the supplies will be shifted there, and we may find ourselves shifted. So what I would say to people is, practice what you can now, what you did before, so that we don't find ourselves the way other communities are right now.
What about any vaccine? People are looking forward to that. I mean, we all want to get back to normal. When can we find something like that? Yeah,
the vaccine question still remains as a big unknown. I'm hopeful that we'll get one. There's lots of, get one soon. There's lots of different trials and vectors underway to see what'll be the proven vaccine. A couple early phase studies that show that we are able to develop an antibody response in the setting of administration of a vaccine, which is good. The next phase are phase 2 trials, where we look at safety. We're in the midst of a variety of phase 2 trials as we speak. And then phase 3 trials will be the large, widespread trials where we administer vaccine to tens of thousands, maybe hundreds of thousands of people to see if they're safe and effective. The biggest concern, once we have proof of concept, is whether there's untoward safety effects that we need to worry about. The vast majority of vaccines are exceptionally safe, but we have to be sure that. That's why we do the trials. It's not all about scientific theory, it's about clinical trials that show safety. I think it's important to remind people that while we don't have a vaccine yet, we do have something that's equally effective or as a moderately effective vaccine, and that's a mask. You know, that studies have shown that we can decrease the spread of the virus by wearing our masks, and that masks are safe and effective in preventing transmission of the disease.
Dr. Hathaway, thanks so much for joining us today. You always provide the community with a wealth of information and keeping everybody up to date and informed on this virus as we proceed through it. I want to let those who are watching know that we do have a COVID-19 page at missionhealth.org. If you go to our website, there's a red bar at the top. Please click on that. There's a myriad of COVID information there. And there's also a COVID-19 uninsurance hotline that we're providing right now. Many people have been furloughed or laid off or without work right now, and therefore are also without their insurance. So you can call that hotline for help navigating your COBRA, navigating the health exchange, and Medicare or Medicaid. There are professionals there who will help walk you through filling out these forms and finding the best answer for you if you find yourself currently uninsured.